everyone. Welcome back to the Medical Fitness Podcast. My name is David Flench. I'm the president and CEO of the Medical Fitness Association. I'm here as always with my two co-hosts, Jeff Young and Thomas Hammett. Jeff, Thomas, how you guys doing?
I'm doing well, David. Thanks. How are you?
Good, good.
Yeah, doing great. Beautiful day here in the Northwest. So happy to be here, David.
Awesome. Well, today we're talking about qualified staff as the differentiator in medical fitness. And I think a lot of organizations in our industry, our space, they're investing in a lot of different things: equipment, technology, marketing, a lot of things that matter. But the ones who are really starting to separate themselves, I think, and really use the true medical fitness model are definitely investing in something else. And that, to me, is the capability of their staff to actually deliver within the medical fitness model. And so as we start to close the gap between fitness, healthcare, rehab, yeah, I think that bar is just getting higher. It's not necessarily just about having credentials on paper. It's really turning into whether your team can actually operate in a more complex, clinically integrated environment. So I'm looking forward to this um, conversation today, and I know that both of you have really good perspectives on this. So why don't we just dive in?
Yeah, I appreciate your introduction, David, and I'm also excited to get started with this. And we obviously talked about the topic a little bit beforehand, so that we aren't just going into this blindly. And I want to start off with the first question because I'm just curious both of your responses and perspectives on it. So we'll lead this off with how the expectations of staff, or I should say, how are the expectations of staff shifting as models become more clinically aligned? What does that mean to you, and what are your thoughts on it?
Yeah, I mean, I'll go first, Thomas. I'm interested to hear, especially from a clinical perspective, some of your thoughts on this too. But I think as medical fitness really becomes more aligned clinically with healthcare, uh, to me, those expectations of our staff in a fitness center are definitely changing and need to change. So, you know, they're not just leading programs. It's more to me about understanding conditions, people that they're working with that have more complex situations going on. Certainly the basics still apply, but modifying things, I think that's a big expectation of what staff in a medical fitness center need to be able to do. I also think there's a shift in expectations in terms of being able to communicate with clinical teams. So your referring physician or other clinicians, and delivering the program with the most evidence-based consistency, the intent of what you're trying to do is all really important. So I think those are some of the big things I see as we shrink this gap and connect more with the healthcare world, where the expectations of staff are also changing.
You guys might think my answer to this is really simple, but I think the best thing that a fitness professional can do to be clinically aligned is just to be a good teammate. At the most basic level, to be a good teammate is, and maybe I'll take a step back for a second. So, like, what qualifies me to answer this question is that I interview fitness professionals. My history of doing so across like 4 states with several different rehab and medical setting type clinics, and supporting some independent groups as well with thinking about how they'd interview and hire, and then onboard their medical fitness staff. So I've interviewed a lot of medical fitness professionals. I've onboarded and supported the onboarding for a lot of medical fitness professionals. So the question of what makes someone good at this starts at the beginning. And when you think about where we start with people, the most basic thing that I tell anyone when we're interviewing is if you want to be a good candidate for this position, be a professional, show up to work on time, gain the respect of your peers, communicate in a way that does not lose trust quickly. And that would be true probably for most jobs, right? And the clinical alignment part of this, David, I think you make a good point about uh, because if we get into the weeds later on down the line, it's important to understand the nuance of your job and to be able to support a more medically complex patient. I think some of that falls on the fitness professional. I certainly think a lot of that falls on the organization. And some of the answer there may be, okay, professional person, you need to be able to modify on your own without support. That's just an expectation of the job. Sometimes it's okay to just reach out to the referring provider and say, hey, this person's struggling with XYZ, right? I've got a patient with MS who has low energy when they come in for their workouts. I haven't seen something like this before. What do I do? So I guess that's where my head goes. To me, certification doesn't matter a whole ton. It gets people in the door, but is not the answer as far as what supports people. And I might be jumping the gun a little bit, but the most basic professionalism, being a good teammate, is what I look for. And a lot of the time, again, on a resume, I look for people who have retail experience. Have you been in a customer service setting before? Is this your first job? What kind of lift is it going to be to teach you to be a good communicator and a good person to people and to serve them as your default? So I guess that's where I go with this, and not necessarily focusing so much on the clinical aptitude because that's teachable. So
Good points. And Jeff, I'll let you jump in as well, but I want to highlight what you said. I think in some of my past, that's exactly the way it's worked. And in some of my facilities, the most ideal setting is where you do have a variety of professionals being able to come together, talk about situations. One of my facilities, we had a case review type of thing weekly where we talked about these situations, and that was very helpful. And so, yeah, having the resources, you're not going to have every single answer to every single situation, and so I think that's just a huge point to this. And I think what you said is, yeah, the credentials matter to get you in the door to say, yeah, you're baseline qualified. But they're not going to really prepare them for everything that they need. So it needs to be that collaborative approach.
Yeah. Oh, my when you first started talking about this, David, my mind went more towards the programming side. But then when Thomas chimed in with what he said, I was so glad that that was your start point, Thomas, because you and I have had this conversation before, and it's exactly right. You can have all the book knowledge or whatever, certifications and degrees that you want, but and just like you said, David, that gets you in the door, but you need to show during the initial interviews that you're the type of person who has social skills, who's like the things that I'll look for in an interview is, do you have social skills? Are you looking at me in the eye? When I ask you questions, can I see your mind churning? I actually don't even care a whole lot sometimes if you don't get the answer right. I just want to see that you're a thinker. And then Thomas, you and I have talked about show up early, be on time. But you actually reminded me that when I first started at Mount Sinai, and I was 10 years into my career, and our uh, program director, who was a physical therapist, Yvonne, one of the first things she said to me, like day one, day two, was, "I don't want to have to babysit," and she said it very nicely. It wasn't like talking down to me or anything like that. It was just a part of a casual conversation. But she said, "I don't want to have to babysit. Dress professionally, come in early." All those little things that really set you apart. And then I could tell once we started getting into journal clubs and started the interaction and stuff like that, I could really, because this was my first time truly in a hospital setting of that type. And so I could see very quickly that, yeah, you really need to have those types of skills to be able to function properly in this type of atmosphere. I will quickly say, since my mind's always on the programming side as well, and I don't want to get too deep into this, but I do think that it's important to talk about the programming side as well, which I think we'll get into later, because I think that it's a gap in like in the fitness industry. I think in my experience, the fitness industry needs to do a better job of explaining how to modify. Uh, if someone has a neurological condition or a cardiovascular condition or a metabolic condition or a pulmonary condition or whatever the case may be, I think in academia, even exercise science programs, even up to the graduate level, could do a better job of not only explaining those things, but having the exercise professional feel comfortable with making those types of modifications. And uh and you know, in my experience, um, clinicians, unless they have that degree in exercise science as a back as part of their background, sometimes there's a gap there too, where you might go to them and say, "Hey, I could use help on such and such when it comes to programming," and the answer might be a little bit more related to the modifications from, I don't know, a symptomatic side, which can be helpful and everything, but not necessarily from a set rep scheme or whatever. So I could go deeper into that, but I think we'll wait. But that's where mine went. But I'm glad, Thomas, that you started where you did, because that is the foundation.
Yeah, Jeff, I think it's interesting. That may be a good segue to just jump into that right now, because I think what you're talking about is the individual aptitude. And the other side of this that I would probably appreciate representing is uh, what an organization who hires these people needs to do to make sure that there's success, right? It's not just the individual's responsibility or the fitness industry's responsibility to get people to a certain aptitude. If you're working within an organization, that organization should have a pretty clear set of guide rails and identity about what they do uh, to support their medical clientele. So maybe you should, if it's all right with you, just jump right in on that programming side. What do you think that needs to look like?
Yeah. I'll do the best I can, and then if I'm not answering or straying, then draw me back in. But one of the things I think about, and I'm actually going to use my wife as an example, because she was diagnosed with multiple sclerosis in 2004, and I didn't start at Mount Sinai until 2006. So she was 2 years into her diagnosis, and she was really sick. It was flare-ups every single day, and her health was spiraling downhill. So she's freaking out, I'm freaking out, scared, all that stuff. Now all of a sudden I'm at Mount Sinai and I have access to family medicine, internal medicine, physiatry, physical therapy. So I'm taking full advantage of that. And also we had a nationally recognized PM&R fellowship program as well. So I'm tapping into everybody. And so for example, I was thinking more about how, like, is it safe to go with heavier loads with her? What should the volume be like? Like, how many sets can we do? Like, what that those are things that I wanted to know. And the answers was getting related more to helping me understand disease progression and symptoms, and the medication. Like, she at the time she was on Avonex, and her body was like rejecting it, and so it was more like uh, information related to that, but they weren't really giving me the answers that I was looking for. And to be honest with you, one of the physicians, and I remember this clearly, asked me if I was familiar with post polio syndrome. And I actually was, because I had trained someone who had polio. So I was familiar with what that was. And they were like, you need to be really careful about going too heavy, because the motor units can fatigue, and then and they won't be able to come back and handle the fatigue. So you really need to be careful about going heavy, which was not true. So that's one of the things that I meant about it. And as a way to say that there was a lack of kind of understanding on the prescription side of how to modify, and a lack of I'll say one other quick thing. I realized quickly when I first started Mount Sinai and working along with the orthopedic side, physiatry, physical therapy, occupational therapy, etc., that and I'm simplifying the way I'm going to explain it here, but they were obviously masters at therapeutic exercise and a large toolbox of exercises and progressions and regressions and pain management and that whole language. So I could clearly see that, man, is that a gap on my side? But I could also clearly see, since they didn't have backgrounds in exercise science, that they didn't understand things like periodization, and that that's a framework to work within. since and that's part of the fitness industry's problem is we teach periodization as it applies to athletes when the truth is it applies to everybody. But those are just two examples of what was going through my head when I said that.
Jeff, it's really interesting and great to hear the personal story. And I've met your wife and she's a wonderful person and I can't believe she puts up with you. But that's a great, great example of, some misinformation. And so, people are probably thinking, well, how do we get that type of, knowledge to be able to apply? and
Yes.
and and, and I think from talking to you, from some of my own personal experiences, it's a combination of things. So there's the real world experience, on the job, where you're interacting with others who may have additional knowledge and training in these spaces. It may be your own specialized training. You probably know as well as anyone, having authored a book on medical fitness, a lot of those principles that can be learned throughout different types of specialized training. So I think there's a lot of ways to get there. What would you say? And Thomas, feel free to jump in on this as well. But what are some of those ways that some people can practically look after, look into getting more knowledgeable?
Yeah, I'll chime in first. There are four um, domains that I'm aware of where you draw or pull your fundamental principles from. One would be basically biomechanics, and then from there you can just open up a whole can of worms because you can just break that. What does that mean? But generally speaking, human movement. How does the body move? And you can break it down into the lever arms and fulcrums and stuff like that if you really wanted to. But what I'm actually trying to get at is that's one domain, human movement. How's the body move? And then also, injury prevention, rehabilitation can fall under that domain. These domains overlap, by the way, as I rattle them off. It's not like it's completely separate from each other. But biomechanics is, in other words, you need to know your textbook biomechanics is one of the things I'm getting at. Textbook knowledge of biomechanics is really important to understand human movement. Textbook knowledge of physiology and how the body is adapting to human movement is really important. So really do need to understand textbook physiology, which can then be broken down into a zillion different subdomains, bioenergetics and cellular physiology, etc. But the truth is, the better you know it, the better you understand how the body is adapting to the program that you are giving to someone. So the biomechanics is the movement part, the physiology is the adaptation part, and then there's two other domains, or one other main domain, that's behavior. And we obviously can break that down into a million subdomains with adherence and motivation and discipline and all the associated things, the ecosystem you live in and how that's affecting you and how you might be able to adjust things based on that. And then the last one, which is more of just like an overarching umbrella, is the medical side and the modification side. So how do we take how the body moves, how it adapts, and the person's behavior, and then how do we modify those things if clinically when someone has one or more conditions. So it really does start with textbook fundamentals and being grounded in those things. And hopefully you're learning those things in your exercise science programs or your certifications or whatever. But it's important to understand that that's where the fundamentals exist, and to stay rooted in them so you don't get uh, uh, deceived basically by the latest influencer or the latest study that came out or whatever.
Something that we talked about between our last couple calls was the structure of education for fitness professionals compared to other medical professionals. So if you were to overlay the fitness professionals' standard education with a medical provider's standard education. I'm a physical therapist, so it might be easiest to say what PTs do. Fitness professionals are either uh, they get a certification as their primary education, or some people get exercise degrees, bachelor's level degree, sometimes even a master's level degree in exercise physiology or exercise science or kinesiology, whatever we call it these days. And then they graduate into the real world, hopefully with some kind of certification, but that would also be some kind of test, right? You take some content, take the test on your own, and then you'd have that certification. What medical providers are required to do through their training in school is some level of clinical internship or observation. I've actually seen this starting to be more common for exercise science grads. We work with a program up here that's Seattle University that sends us interns as part of their required training. And even my alma mater, Washington State University, is doing the same thing where students are required to have some kind of interning. Jeff, if you wanted to build acumen in those areas that you're speaking about, it's really important, obviously, to learn that stuff in school. I've unfortunately seen so many graduates of programs come to us for interviews and have basically no aptitude to apply what they know. And the mentorship and practice that you get through some kind of internship, some kind of residency program, the stuff that's built into medical programs that fitness professionals just don't get at a structured level in their education is really important. And I think if I was going to give advice to fitness professionals that are struggling to feel like they're making the cut or identifying where to start, I'd say this to anyone. If you want to try something new, learn the basics, then get a mentor. Find someone you can look up to who's going to give you real advice, and spend time working under them and be humble about it, right? Like that's the kind of stuff that builds real expertise. And obviously, Jeff, you laid out a really good what you need to know kind of thing. Find someone who knows that stuff or is good at some of it, right? Some people are going to be good at the behavior side of things and maybe not so strong in the prescription side, and vice versa. I've for some reason found that there seems to be a one side or the other of we have really good behavioral coaches who struggle a little bit more on the prescription side, and really good prescription professionals who struggle a little bit more on the coaching side. And maybe it's a little black and white thinking on both sides of that. But I guess that would be my thought would be if you're in a place where you need to build your expertise, get the baseline knowledge, then find someone who you can work under who knows better than you do.
Yeah. Great points, Thomas. I can't agree more with taking that initiative to do that. I think the other side of it though is also important, is the facility who is interested in running a new program, offering new services, and that's a strategic decision by them. What are they doing? So if you're running an organization, then the strategy around that has to include investing in your people. And I alluded to that in the opening here. I think, making sure that there's enough investment in staff. I can remember at one of the places I worked, putting in a pretty hefty staff development budget and coming to the hospital CFO for my budget defense. And they told me, yeah, we don't really spend that much here. And I held my ground. I said, if you want to have a good medical fitness operation here, we're going to have to invest in staff development. And it actually, I made a post on LinkedIn and I included one of my real favorite exchanges, that, the anecdote thing where a CFO says, what if we invest in staff and they leave? And then the CEO comes back and says, well, what if we don't and they stay? And it kind of highlights the idea of, if you don't invest in your people, and you think you can really have a great program, um, that's short-sighted. And yes, you need to manage staffing costs and your overall budget. Those are important, but it's it can be a very strategic thing to invest in the proper kind of training. I think that's a point that sometimes gets lost in this as well. There's both the personal initiative on individuals' side, but there's also our organizational's strategic decisions that they're making.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association, helping fitness professionals and medically integrated fitness centers achieve their full potential through education, certification, and networking opportunities. Join today and elevate your career with the Medical Fitness Association. Visit medicalfitness.org to learn about the many benefits of membership offered by the Medical Fitness Association. That's medicalfitness.org.
David, I'm so glad you said that because you're exactly right. And as you're talking, the things that went through my mind were like when I first moved here to New York City and I was about a year into my career, my first job was as a general manager at a condominium health club. And, I didn't know I was in a rut at the time, but I was in a rut because that was the ecosystem. That was the culture. I had nothing to improve my knowledge and skill set. I was just a GM at a condominium health club. That's it. And then my next job was at an executive health club in the banking district, but it was just another rut. It was like a 6-year rut because the culture there wasn't designed to help improve knowledge or skill set. I was just training people, And so then I go to Mount Sinai, and it's medical fitness. And now it was a whole culture, and I keep using the word ecosystem, but that's exactly what it was. And it was very academic. So it wasn't just us working in silos where we just went in, clocked in, trained people, treated people, and then went home. We had in services, and we were always like, for example, the physical therapist, when they saw I had downtime, they would see that and they'd say, "Hey, come into the treatment area, Jeff. I want to show you things." So I could see that side of the fence, and like I could, and they would help, teach me and their perspective so I could see through their eyes. So it was a whole culture. So you're exactly right. Yes, we need to do things at the individual level from the bottom up. And Thomas, what you said, you're also so right because I didn't have mentors in those first two jobs that I mentioned. There was no mentoring. But now all of a sudden I'm in Mount Sinai and it's like mentor heaven. And that's actually the reason why I feel like I was able to move forward, like almost this is all in hindsight, but I feel like it was kind of at a rocket pace because now I had, physicians taking me under their wing and physical therapists taking me under their wing. And the in services. And now it's forcing me to have to look at research, and studies and things that I was scared of. I don't understand this stuff, but now I'm being forced to do it because that's what we're reviewing. So yes, you're exactly right. It really needs to start also with the system that has the mentoring and has that type of stuff. And that's, I'm going to put a plug in for the Medical Fitness Association. That's where it comes in, right? Is become a medically certified facility. And I'll also put a quick plug in for my course because there's your bottom up level, right? And when you do those things, then now you have a place to start and a place to grow.
Well, I think organizations who are intentional about creating systems like that, a mentoring program, I mean, the best organizations do that type of thing very intentionally. They set those things up so that it's not just by chance that it happens.
Yes.
It's specialized mentoring programs. It's specialized training certifications, sending people away take to conferences and other things to learn from others. So I think that has to be part of the strategic intention of an organization as well.
Yeah, I'll say one other thing. Our medical director, Dr. Rob Gotlin, once I was there for a while and started to become comfortable and he could see that my knowledge and skill set was improving and all the mentoring that I had received, then kind of moved me into mentor position. Where like, for example, when we had um, DPT, Doctor of Physical Therapy students from NYU and Columbia coming through doing their clinical rotations, part of their clinical rotation was to come to me and spend several hours, and learn about the medical fitness side. I actually even developed and ran elective programs for family medicine residents and for PM&R physiatry residents as well. So, first it was scary, but then, it's a win-win situation because I'm teaching them about medical fitness and they're out on the floor watching what that's all about and everything. So then they're winning, but I'm winning too because I get the opportunity to pick their brains So it's exactly right. You really need to be intentional about creating and not only have it happen organically, but actually create these types of programs and systems.
Well, I always thought that it was a good way to retain your best staff as well. Because it does not happen at every
Yep.
organization. If you are investing in your staff and partnering on, hopefully on some of the things that they're passionate about and have particular interest in doing, and supporting that level, that should be a great way to retain your best staff and show them that you have their career in mind as well. All right. One of the things I wanted to hit on was maybe, why this all matters. Why does it matter to have this level of expertise and knowledge, even on the, soft skill sides, but, both sides of things, soft skills, technical skills. Why do we think this is so important, especially in medical fitness today?
I'll start by saying because it does matter. And the reason why it does matter is because we're on the healthcare continuum. So we need to care about people's health. Like to me, it's that simple. We're, I'm not a licensed clinician, so I guess I wouldn't technically be called a healthcare provider, but I operate on the healthcare continuum. And if healthcare means you care about people's health. And so that's really where it starts. You should care about individuals' health that you're working with, especially since we live in such a sick country where upwards of 70% of people are walking around with either living with obesity or chronic disease, musculoskeletal conditions. And then we also should be thinking about public health. And if we all cared about people's health and wanted to improve our own skill set, hard skills with exercise prescription, soft skills with active listening and empathy and things like that, then and we become better practitioners, then ultimately that's going to move up to public health and we're going to make an impact at all levels. So that's my response.
I'm struggling a little bit with this dilemma of it is really important. Uh, it's really important that individuals become skilled, really skilled, because I think it's a pivotal moment. Jeff's identification of we should view medical, or excuse me, fitness practitioners in this space as medical practitioners is true. And the unfortunate reality, and Jeff and I have talked about this a lot, when you look at the pay that fitness professionals get alongside other medical professionals, it's pretty tough to justify the extra cost of training, the extra expense of training, especially if it goes towards that individual, because they're not going to be paid anywhere near what other medical providers are going to be paid. And that's just a truth. The median pay for fitness professionals is significantly less compared to other medical providers. And it's because fitness professionals, while being recognized at some level as being within the medical spectrum, as Jeff speaks to, as they should be, because we believe exercise is as powerful of a prescriptive tool as any medication for most conditions. Um, but the payment for these kind of services does not give people who work in the field an opportunity to make a living wage unless they're seeing people at a high scale, so seeing a lot of clients, or are seeing a clientele that's willing to pay a lot of money for a premium service. Um, and there's no insurance coverage for exercise outside of really specific domains like cardiac rehab and some other, physical therapy would be viewed as one of those. When you're hurt or have a significant impairment of dizziness and balance, you can go see a physical therapist and have that covered by your insurance. And PTs get paid pretty well to do that, relative certainly to fitness professionals. Otherwise, there's no insurance-based payment for exercise, and that puts fitness professionals in a tough place. Do we continue to get ongoing education to justify that kind of payment, to justify being in that world? My answer to that is yes. I think that that's the place that this needs to go, but just recognize, dang, it's a hard time to be doing that right now, because those people that are investing in their ongoing training are doing it for a population, the people who need it the most, the people who, to Jeff's point, people with obesity or chronic disease do not necessarily want to exercise and invest their time and money in exercise, um, except for in certain moments. And the again, the status quo, what people pay for their fitness in the United States is a low cost gym membership. So if that's your anchor, it's just a really tough place to live as a really skilled, underpaid person. And I just think that needs to be recognized as part of this conversation because as an individual, yes, do your best to become really skilled and learn this stuff because the profession needs it, right? But the profession's also not in a place where it's serving you at the level it should yet. And I think that just needs to be recognized, and you can be a part of that by becoming as skilled as you can.
Yeah, I couldn't agree more, Thomas. It's a huge challenge for us right now. I think, there's definitely some work being done on multiple fronts in those areas. Advocacy on the professionalization of the fitness industry, reimbursement side of things. Waiting for those things to happen probably is a losing battle. And so I think some of the other points you made were good, but it also kind of reverts me back to having the organizational support. So it's not just thinking of these things as a nice perk, but really supporting the overall strategy. And if it's a well-run business as well, they're doing well and should be able to support this type of improvement in overall level of staff qualifications and so forth. But I do believe, if it also the whole topic of why it matters goes back to the words credibility and trust. And you're not going to be part of the overall healthcare delivery pathways because just you have a great program. You have to have staff that are trained, evidence-based, knowledgeable, and the referral sources trust those people because either you're promoting what your staff know and their backgrounds and their level of training and those sorts of things. So I think the trust in the staff delivering is a very important piece in creating the credibility. Yes, there's a whole side of reimbursement, and I think there's probably more than one podcast episode that we could devote to that. But I think, at an organizational level, understanding, I'll just keep going back to that, having the strategy that, if I want to do more in this space, I have to have support the staff that are going to be delivering it.
Yeah, completely agree with that. I mean, I'll plug I think it was called "Developing Trusted Relationship with Exercise Professionals," article that I co-authored with Dr. Amy Bantham from the PAA and Dr. Matthew Campert, who we all know. And again, as you were talking, I'm thinking back to my time in these clinical settings, and like for example, it was Mount Sinai where I was the fitness coordinator. When we would hire a new exercise specialist, that was always a talk that I had with them. You can't just expect that they're going to immediately refer patients with you, and they're not going to, and nor should they. There has to be a trust develops. So you have to show, you have to be here, you have to be present, you have to be, that's where the social skills came in as well. You have to be communicative. You have to want to show that you're a sponge and want to learn. You have to build that trust in order for them to want to refer. And it's just the truth. And if I was a clinician, I'd be the exact same way. So it's definitely not a complaint.
And
So
Thomas said it early on, be a good teammate, right?
exactly right.
That's what I heard you just say.
Yep. It's exactly right.
Yeah, I would reinforce even Jeff's point so good. And I'm going to contradict something, not totally contradict it, but just say that I I think the relationship side of this, your ability to be a good teammate matters more for this trust and credibility even than
Yes.
your skill as a exercise scientist.
Yep.
The skills and exercise scientist matters, but if you're going to be successful in a medical continuum, your ability to build trust and even the credibility side, yes, the aptitude matters when it comes to credibility, but it does not matter at all if you can't communicate with the people who are sending patients to you and who you are sending patients back to, hoping that they're going to sing your praises, because otherwise they're not going to sing your praises if you're callous and coarse in the way that you communicate.
Right.
And even just basic goal setting kind of stuff. We didn't really get into a lot of the, because we've talked a lot about, 3 of the domains that Jeff listed in terms of skill set. But man, I would argue probably the most important skill set for gaining and retaining clients is that coaching element of can you help someone understand what they're doing there, um, with their own words, and help them commit to a program that is regular and outside of their previous norm. Man, it's so important. So both with the client and with the people that are referring to you from a credibility standpoint, that ability to be a people person when you're on at work matters.
Well said, Thomas. Love it. Jeff, any final thoughts here on this topic of qualified staff as a differentiator in medical fitness?
The only thing that comes to mind, honestly, is that I hope that listeners think about reaching out to us, as support. Like, if, in other words, if you're wondering, well, where do I go? Where do I start? Well, this is our passion. This is what we do, and I'd like to think that I speak for all of us when I say that we can be a support system as well. So if you don't know where to start or how to get started, or you have questions about anything within from a individual level and as a coach or a trainer, as at a systems level or anything in between, reach out to us for support, because I'll speak for myself. I would be happy to help.
Jeff just out offering his mentorship to the public. I appreciate it though. What's great about that, Jeff, is that you've spoken a lot about the mentorship that you received as both as a student and as a young fitness professional. And I think a hallmark of people who get that, like get the investment from others, is the willingness to pay it forward.
Absolutely.
So I appreciate your willingness to be the public's mentor on this. I'll chip in and help as I can, of course. But no, I think it matters, and it's you can see people who have been invested in because they're the people of the next generation that are willing to invest in others. So
Appreciate
And
that.
what a better way to close this with the idea of paying it forward. I love it.
that's right.
Love it. So, well, this has been a great conversation, guys. I've really enjoyed it. I think there's some really valuable pieces that hopefully people can take some information away from and apply it in their own settings. Thanks everybody for joining us today. Look forward to bringing you more on the Medical Fitness Podcast going forward. Thank you.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.